The toll of COVID-19 on African Americans is tremendous. 1 in 1,000 in the country has expired from this disease. This is decimating the population. The healthcare system does have built-in inequities. It is systemic, it is endemic, and it is not new.
I work at a beauty supply, and one of my coworkers was sick. But she was like, it's not coronavirus or anything. And I'm like, girl, I have a bad immune system. I hope it's not. And the next thing you know, I felt sick. I couldn't breathe. I could barely walk to the bathroom. And I was by myself when it got like really bad. I called the hospital. They told me not to come. And I'm like, I need help. And they're like, do you feel like you're about to die? And I'm like, yeah. They're like, well, just stick it out. I felt like they told me just stay home and die. I was overdosing myself on flu medicine because I felt like that was the only thing that could probably save my life. And that's when I found the clinic.
In this community health center, in this underserved community of color, I've seen the damage, the fear, the anxiety that the pandemic has done in communities like mine. And there's a certain level of distrust of the medical community amongst the African American populations. Some of this going back toward, things like the Tuskegee experiment, where African American men in the South were not treated for syphilis for an experimental purpose. African Americans suffer from disparities in so many areas: high blood pressure, diabetes, HIV, now COVID. Some of the disparities would lead to distrust because they're like, why are we sicker than everybody else? One of the things I'm passionate about as a community health provider is to let people know health is your right. Health is something you have access to. You just have to educate yourself despite the system.
I feel the same way about doctors as I do with the police. Who can we call for help? The people who we're told to call, we really can't call them.
When they hear it from someone like me, they may trust that more. I can change someone's life and their trajectory just by changing maybe their way of thinking about something so they don't end up in the hospital or end up dying.
I almost lost both my parents in 1 week. My dad fell and he couldn't get up. So they took him in to the hospital that night. They said they were treating him for pneumonia. They never mentioned COVID, not once. And my mom had it, and then when we got to the hospital, the doctors completely ignored COVID and said she has renal failure, we're gonna treat her for that. I said, if you allow them to keep you here, you might not make it out of here alive. And we made the decision as a family to not admit her. So we decided to bring her back out to her primary doctor. You feel helpless. That's the worst feeling, knowing that you can't do anything about it.
When African Americans interact with the healthcare system, there is often discrimination on the part of physicians. They're not always given the same care that their white counterparts are given. That plays into the systemic racism that's built in. Many patients don't go because they're afraid. I hear them calling me on the phone, terrified of what should they do. I can't breathe, I've taken my breathing treatment, and you're telling them, go to the emergency room. No, I can't go to the emergency room, I'll die. As far as they're concerned, they have a valid reason to fear for their life if they try to go in and get help.
My dad, he passed away alone. And this could have been avoided. Is probably the most frustrating thing I'll probably never get over. My dad lacked the treatment that he should have gotten, that my mom did get eventually, and ended up saving her life.
That's a picture of our first wedding reception. And then there's another picture of our 40th one.
And there's the last picture he took with his grandchildren.
He could be happy the last few minutes of his life because he had these moments. The last phone call that I got from him, he said, I love you. And I said, I love you too. He said, I love you one more time. And I said, all right, and you got your clothes and I'll see you real soon. The next morning, I called the hospital and she said, oh, Mrs. White, we tried to call you yesterday. She said, Mr. White is gone. He passed away. And I was just so shocked. I couldn't realize how he was gone that fast in one day. It was nothing I could help anybody with because I didn't have anything to go on. So I'm literally starting over again from scratch. I do believe that my daughter and my son saved my life. If they hadn't brought me to the doctor, I believe that I would have just been ignored and not taken seriously until it would have been too late.
Both my parents was not treated for COVID, and my dad ended up dying for it, and my mom had it, and she was dying if we hadn't saved her life. It's unforgivable. We all live in this country together, so how can those death rates and those COVID cases be so, why is it such a big gap? So if the virus doesn't discriminate, who's doing the discrimination?
Now all I hear about is Hispanics and Black people getting it. And I'm quite sure we're all breathing the same air, so how come I'm the only person getting it and people that look like me? Us as Black people, we get pushed back, we don't get taken seriously. So it's very serious for us to get the respect we deserve.
Black people always know their lives matter. It's how do you make sure everyone else understands that too? A stress to the nation, to the society of something like COVID, it exposes all the wounds, right? And I think it gives us, in the medical community and as a country, some really clear objectives that we can work on. Because you think health should be an equalizer for everybody. We got a vaccine coming out for this. Can we make sure it gets to these communities so now everybody's protected?
All we want is equality. And we've been screaming that for decades. Our skin is 1/3 of an inch thick. Think about all the hurt and the pain and the deaths over the hundreds and hundreds and hundreds of years in this country based on 1/3 of an inch.
We want a better future. We want everybody to be respected. We want all people to be able to get the same treatment. We can't go back to 3/5 of a man. We are all whole human beings, and we need to all be made whole by the system in which we're raised.